awesome. We're here at HIMSS, Vegas. I think everyone's heard of that, but I'm super excited. We have Jitesh, Ghai. So please introduce yourself. So glad you're here.
Pleasure. My pleasure to be here. Thank you for having me.
Thanks for being here.
Jitesh, Ghai, CEO of Hyland. We are we're the trusted custodian for healthcare payers and providers in the US as well as globally
Right.
for all things unstructured data, all
Oh,
things
interesting.
enterprise content.
Okay.
So documents, images,
Right.
et cetera. We're over $1 billion in revenue. We're the biggest at what we do, exclusively
Exactly.
focused on the hard data problem.
Absolutely.
And we have the great fortune of serving 14,000 customers globally, ensuring they're making the most of their data while being compliant, while ensuring data is only accessed by those that should access it.
Exactly.
And automating processes, critical business processes using this data for, like I said, payers and providers globally.
That's wonderful. So I'm interested. That's a completely different industry that a lot of players haven't been in, the unstructured data industry, right?
Yeah.
What led you down that path, and why did you decide to go out and tackle that very difficult challenge of making valuable information out of all this unstructured information?
Yeah. It's because it's a hard problem.
Right, right. It is
We
exactly.
like hard
I'm like,
problems.
right.
I've been in the data space for a couple of decades, and what's uniquely exciting at this point in time
Right.
is there was only so much you could do with unstructured data up until large language models became a thing.
Right.
And GPU, whether training or inferencing compute costs became economically feasible.
Sure.
So now we find ourselves, we're 3 decades in the making in serving our customers. We're the trusted custodians of medical images, patient records, provider records, as in physicians. We house operational and clinician
Right.
data and automate mission critical workflows for organizations. What's uniquely exciting now is with technology tailwinds like large language models, like the kind of compute available for processing, for inferencing, there's much more value you can deliver out of unstructured data.
Absolutely.
And data within the healthcare industry is growing extensively, and 75 to 80% of it is unstructured data. So you think data, everybody talks about reporting and analytics and
all the
data
discrete
science
information.
that's all structured
That's right.
data.
Discrete. Yeah.
And if you look at healthcare, so much of what happens
It's unstructured.
is unstructured. It's
Right.
notes.
That's
it's
right.
Patient. It's provider notes.
That's
it's
correct.
patient notes. It's
Nursing documentation.
It's
all of
literally
that.
facts.
Right.
Faxed data and hundreds to thousands of pages of PDFs
Exactly.
that now we can deliver incredible value out of.
Absolutely. So I just had a quick question about, you mentioned trusted custodians. That's an interesting description. So expound on that a little bit more. How the term trusted custodian, what does that really mean in terms of what are you doing to make the information you're collecting insights,
Right.
knowledge
Right.
for the doctors, patients, administrators?
Yeah.
Talk a little bit more about that.
Yeah, for sure. Think of it as we are exclusively focused on enterprise content management.
Right.
Is the market, it's the
Right.
space, which is essentially unstructured data.
Right.
Like I said, documents,
Sure.
medical images, so
Right.
on and so forth. Step one of making organizations productive with their data, highly sensitive mission critical data, is ensuring it's stored in a secure place.
Sure.
Ensuring that it's appropriately governed and versioned,
Right.
so that only the right people have access to the right data.
Right.
That is the foundation. If you look at NYU Langone,
Right.
every driver's license, every insurance card, all of that is scanned and persisted in our database.
And that's valuable data in the black market.
And it's all governed.
Right.
So that only the right people have access to it. Now,
Exactly.
we don't stop there though. Simply being custodians, very important service we're offering to our
Right.
customers. But from that, because we have the content, we can now automate mission critical business processes
Sure.
like patient onboarding, patient referrals.
Right.
We can automate the work lists and tasks for radiologists as we house all of these medical images
Sure.
for them to help them do the analysis and work through all of that. That's what we've been doing.
Right.
And now, really, where we stand is we're building AI agents.
So
that-
you're using things like OCR technologies. How are we
All of
turning that
the-
structured
all of
data
the
into
above.
okay?
All of the above. You
Yeah.
know, the capture can be
Right.
from OCR technology, but
Right.
there's technologies come so much further with large language models.
Right.
We launched at HIMSS this year, we launched intelligent medical records. What is that? That's taking scanned documents, thousands of pages of different types of documents,
Exactly.
and identifying them, classifying them, separating them, extracting the relevant details out of them because a patient referral has come in and a referral needs to happen. Taking all of that now and then routing it to the appropriate department and automating the scheduling of that referral.
Sure.
What would have ordinarily taken, tens of people, hundreds to thousands of hours,
Right.
we're just automating to seconds. And you can do that now because what required these hundreds of people and tens of thousands of hours, we're now doing is we're now delivering all of that automation as AI agents,
Exactly.
optimized for patient referrals, optimized for identifying gaps in medical records, optimized for patient acknowledgments where you need signatures and so many things.
Sure.
It's such a regulatory sensitive
Right.
industry.
Right.
Um,
And very still manually process driven.
Correct,
Right.
correct. And that's where we're driving immense, unprecedented productivity by building out these AI agents that
Right.
automate these tasks, enabling and freeing up humans, people to work on different higher value exercises within an organization.
So one thing I'm really curious about, I mean, you guys are massive, you're global. I imagine one of your biggest competitive advantages is data centers, computing power. Maybe that's not for this topic here, but I would be curious because now energy for that massive amount of computing and doing that, is there any, do you have data centers and, I mean, how does that work with trying to keep it at whatever you guys do?
Yeah. Happy to share more. Step one, like I said, is persisting the data. And this is petabytes to exabytes of endoscopy, mammograms,
Exactly.
x-rays, CT scans.
Sure.
Along with all this, that's data about
Right.
the patient. That's what we'd call clinical data. There's also the operational data, which I spoke about, which is driver's license, insurance,
Exactly.
this, that, and the
Right.
other. So that's step one. Now, with our AI strategy and AI enabling this content, step two is through a governed framework, deriving the necessary content and inferencing insights from it to help clinicians diagnose and deliver better, more complete, more connected care experiences for those that need medical assistance.
Absolutely.
That's where we take the content and thoughtfully run it against a farm of GPUs to do the necessary inferencing to give analytical insights. But we don't stop there. That's analytical insights from unstructured data, which has never happened before,
Sure.
but is possible now because of Gen AI, because of the kind of compute that's available now that hasn't historically been
That's right.
available. But then from those insights, you can now automate mission critical business processes for providers and payers.
Exactly.
You can help expedite the claims process of care that somebody has experienced
Right.
by making it agentic, taking these workflows. We've been automating these workflows by bringing and driving collaboration, bringing various people within an organization and between organizations
Right.
together. But now it's not just about bringing those folks together to review something and click approve or move it to the next step of the
Sure.
workflow. You can take a workflow that involved 5 people and apply artificial intelligence to eliminate the need to have
Human
people
intervention there.
involved.
Right.
Yeah, human intervention
Right,
involved.
right. I was going to ask, you know, as you know, clinicians, healthcare professionals are creatures of habit, right? They're used to doing processes a certain way.
Yeah.
And now you're coming in and literally disrupting how they do their business. What's been some of the challenges you may have experienced in going into some of these health systems and hey, and saying, hey, we can come in and automate these processes
Yeah.
and eliminate, you know, people touching the, the administrative task associated with it, or even the clinical task.
Yeah.
What's been some of the reactions you've gotten from healthcare organizations as you've introduced these things
Yeah, great
in the
question.
very beginning, and then how have they seen? Because, and I'm a former CIO, and so and I've implemented technologies, and there's always that initial pushback and resistance to it. But when it's now implemented and they see the benefit, then it becomes almost an insatiable appetite for it. So
Yeah.
I'm just curious from your perspective, what's been some of the
It's a great
challenges?
question. I
Yeah.
would say the biggest challenge is just industry awareness of
Right.
just how much can be automated.
Right,
How many agents can be deployed within
Right.
a healthcare system?
exactly.
That is probably the biggest challenge.
Mhm.
The industry is so paper intensive, so document intensive, so
Right.
image intensive, that helping convey the opportunity of just how much automation and intelligence can be deployed for in support of a payer or
Right.
provider is probably the biggest challenge.
Exactly.
There's a lot of, like I said, it's paper heavy, so there's a lot of signatures, there's a lot of provider acknowledgements, patient acknowledgements associated with care. So how have clinicians, administrators responded? With immense excitement and enthusiasm once they're aware of what can be done
Right.
to take the bureaucracy, the signatures, and all of that away from
That
them
cognitive workload.
so that they can really focus on what matters, which is the care experience, which
Absolutely.
is making the right calls for the right patient.
Sure.
So it's celebrated. You know, Asante, it's a healthcare system out of California.
Right.
We helped them with our intelligent medical records solution take what was tens of thousands of documents, as they described it, a backlog of paper documents the height of 2 NBA players that they would have to manually go through
Right.
to identify specific documents for specific purposes.
Exactly.
All of that took hundreds to thousands of hours. We're doing it in seconds.
Right.
Right? So when they are aware of such technologies, it's frankly celebrated, it's embraced. That's on the documents side.
Sure.
The operational data, we'll call it. There's also the clinical data. On the clinical side, as I mentioned, medical imaging, UNC is a big customer of ours using our AI-powered medical imaging suite that is reconciling all the different silos within a healthcare system. They've acquired
That's
so many
huge.
other healthcare providers,
Right.
and each one of them has a different repository for X-rays, for mammograms, for
Right.
endoscopies, colonoscopies, etc. But there is only one UNC.
Right.
So what they're doing is they're acquiring these systems, is rationalizing all of this mission-critical medical data, medical imaging data, onto our platform. And then we're AI enabling them to then facilitate the consumption of this data, make it easier for radiologists to look and analyze the data wherever they are, at home
Right.
or in the office. Historically, the technology, the state of the art has required massive computers, massive desktops
And I think that's where you were going, wanting to understand.
with immense processing power. The way we've designed our solution, the client is lightweight. All the hard work is happening in the cloud, and they're able to visualize and get great insights from these various medical images
Powerful.
to drive, again, connected care patient outcomes.
Absolutely.
So as we're here at HIMSS, love to see Hyland and HIMSS, what you're seeing just as this conference is kind of coming.
Yeah.
in.
Yeah, what I would say is everybody wants to talk about AI, and
Yeah,
we can
exactly.
talk,
That's right.
but it,
Absolutely.
like the model game. Pick your favorite large language model. Pick your favorite ML model.
Right.
Is a game of commoditization. Everybody, that's where all the mind share goes.
Yeah.
It's not about the models. It's about making those models productive for an organization.
Sure.
To do that, you need the data.
That's right.
To do that, you need the data, and you need to be able to access it in a governed, secure manner.
Right.
That's how we serve our customers.
Right.
The model is only as good as the data that you're able to inference
Yes.
that model against. And those are the problems we're solving.
That's great.
Yeah.
So I'm just curious, as we wrap up this segment, what's the future of Hyland look like? What are the things you're now working on and towards for the next generation of kind of Hyland's technology solutions and services?
Great question. Thank
Yeah.
you for asking. The future for Hyland is, we started with being the trusted custodian of unstructured data of all forms,
Right.
and automating workflows, bringing organizations and people together. But given the technology that exists now, the future of Hyland it's an AI-powered agentic Hyland that is AI powering the content.
Right.
It's AI powering the mission critical business processes and the resulting application and consumption experiences, so that caregivers and patients alike
Right.
have greater transparency about the patient record, and democratizing it, making it easier
That's
to
powerful.
consume, now possible more than ever before through AI. That's what we're doing for our 14,000 customers. That's what we're doing for providers and payers globally.
That's great.
It's truly an incredible time to be in the space of data, specifically unstructured data, specifically in healthcare.
No, absolutely. Well,
We frankly see us serving and delivering exponential outcomes for our customers.
well,
and
well, you're tackling an issue that's been a challenge in healthcare since its inception, and
Yeah.
that's how do you create information out of unstructured data?
Yeah.
Yeah.
And
Mission critical unstructured data. It's not
absolutely.
your favorite photo from your
Right.
ball game or what have you.
That's right.
This is mission critical
Yes.
data that organizations run on.
Cool.
Well,
Thank you so much for coming
well,
on.
My pleasure,
we
Michael.
applaud you for your efforts. Congratulations on all the success, and
Thank you.
enjoy
Thank
the
you.
rest of the conference.
Thanks for having me.
You're welcome.
We're very excited about what we're doing and how we're serving, and appreciate you folks and your questions.
We'd love to have you back in the future and tell us the next generation of Hyland story.
We're moving fast. There's a lot of work to get done. Happy to come back and share more.
Sounds great.
Perfect.
Take care.
Thank you.